While being on lockdown, I've spent my fair share of time searching the web. Have y'all noticed that there's some, well, interesting theories about COVID-19?
Is there a coronavirus? My honest opinion, no. It may possibly be. I don't know.
Hold up. What? Today's baggage, conspiracy theories. COVID-19 is devastating the world both mentally and physically. People are looking for answers, and where do they search for these truths? Their timelines, of course. I mean, this is 2020. But the issue is that social media is a breeding ground for conspiracy theories. See the problem? With social media's ability to amplify, coupled with the extreme uncertainty of the moment, it's no surprise that there's a whole heap of outlandish conspiracy theories popping up all over the place. Boop, boop. Like the idea that COVID-19 is caused by 5G cellular networks, or that the US planted the virus in China.
I believe this coronavirus was dropped in China by the United States government, okay, to destabilize the Chinese economy.
Now, those are clearly fake conspiracy theories, but conspiracies, y'all, they're real. And it's no surprise that Black folks have been the target of quite a few of them. Lest we forget the Tuskegee experiment, which unethically studied syphilis in Black men for nearly 40 years. Or COINTELPRO, the FBI program that covertly surveilled Martin Luther King Jr. and other civil rights leaders. Or that a doctor literally took cells from Henrietta Lacks's cervix without saying little bo peep. And her cells are still used in labs today. But conspiracy theories? They seek to explain an event or set of circumstances as a result of a secret plot by usually powerful conspirators. I mean, there are hella people of all races who believe that Tupac is still alive, that 9/11 was an inside job, or that Barack Obama wasn't born in the US. Birthers, y'all have to let that one go. But for African Americans specifically, conspiracy theories often serve as a way to explain inequality. Like the mythical Willie Lynch letter, which has been credited for making a playbook on how to keep and control enslaved people. Professor Patricia A. Turner is a senior dean and folklorist of African American Studies at UCLA. She's also the author of I Heard It Through the Grapevine, Rumor in African American Culture.
Conspiracy theories have been prominent in the African American community from the beginning, as they are in all communities. I think it's really interesting to start to look at them in the 1960s, when we have simultaneously African Americans making strides towards gaining power, and the perception, of course, that the government, white supremacist organizations, medical communities, other entities are trying to undermine that power. One of the things that provokes us to move into thinking that a conspiracy is going on is an unexplained activity.
But there's a particular type of conspiracy theory that troubles Professor Turner.
The dire warning is this: no matter if you have a flu-like symptom, do not take any vaccines. I'm telling you this now, and this is from the Lord.
So when somebody believes in a conspiracy theory and doesn't follow good medical protocols as a result of that, those are the ones that I find the most problematic. Human beings have always been suspicious of things that are injected into our bodies. It's not surprising at all that a vaccine, when it comes about for coronavirus, will be met with suspicion by some.
What happens when conspiracy theories end up being true? While it's yet to be proven that crack was planted in Black communities, we do know that the war on drugs was a damn lie. This war was created by the Nixon administration to vilify Black people and hippies.
America's public enemy number one in the United States is drug abuse.
How do we reconcile that the man planned it all?
When the drugs were affecting the Black community like crack and heroin, you heard about imprisonment. You heard about punishing. So an individual theory that you had about a particular police force going and getting the drugs from South America and bringing them in and making sure that they got into the hands of 14-year-old Black people, that might have been incorrect. But the larger story that reflected was not incorrect because there was an indifference to the well-being of those 14-year-olds.
There's been some research that's shown that Black people believe in conspiracy theories at higher rates than do white people. So what are your thoughts on that?
I'm not sure I'm convinced about that. I think that's a really hard experimental question to prove decisively. I will say that when you look at the experience of power in the New World and who holds power and who's been victimized by power, it has tended to be African Americans at the victim end of the continuum and whites at the oppressor end of the continuum. So, one of the things that I say in my book is that just because you're paranoid doesn't mean they're not out to get you.
When we bring our attention back to COVID-19, Black folks have had a lot to say. First, it was that we couldn't get the Rona, a rumor that was grossly inaccurate and has since been debunked. In fact, early data shows that the virus is infecting and killing Black Americans at a disproportionately high rate. The same study found that majority Black counties have 3 times the rate of infections and almost 6 times the rate of deaths as counties that are majority white. While there is no one group responsible for the COVID-19 pandemic or particularly targeted by it, we do know that the forces of systemic racism have coalesced, making Black people at a higher risk for the virus. So, given the country's track record, establishing trust with Black folks in a time of crisis could get dicey. Felice León is an associate professor of Africana Studies and Political Science. She's also the author of Trust in Black America: Race, Discrimination, Politics. She says that trust is racialized, and it's no surprise that we're seeing conspiracy theories about COVID-19.
As we have studied data over the years, we understand that there are certain vulnerabilities as far as Black people's health and health risks that are also a part of the environments in which they live. So what that means as far as being exposed to what could be health risk factors, also what that can mean for people who live in low income environments where we find that some of those hazards in living can be higher when we think about this crisis and what that means for Black people having to address having contraction. But I also think, as far as trust, that there's concern probably about, well, what will be the next step? Yes, we have what is a disease that is presenting disproportionately among Black Americans, but will there be public policies that will be in place in order to address this? Will the government see enough need to address these because the virus is disproportionately affecting Black Americans? What is that next step? And what will it mean for Black people believing that that next step actually will be meaningful, right? Something that suggests that Black people's lives matter.
What really would it take to earn trust in a time of crisis?
I think this is a really interesting question, especially as far as, for example, Black Americans, because I'm thinking about what it means for Black Americans even trusting in medical professionals, which there's a history of, yet again, medical experimentation and relationships with Black people in medicine that make that trusting relationship, even with a medical professional, questionable. But in conveying information that people might see as invaluable for them staying alive, it seems as if that could change that trust equation, right? And how people are processing this, quite honestly, I think that this is something for research right now.
So storytellers gonna tell stories, I guess. But when it comes to conspiracy theories, we must use discernment and common sense. History has shown us that Black people in America have reason to be skeptical. Skepticism is normal, but when this skepticism puts wide swaths of people in harm's way, conspiracy theories can put our community in danger. Let's not do that. It's a wrap. 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 Woo, child.